Hi, I'm Erika. I'm the pediatric dentist in Marquette. If you have any questions, ask me. So, let's see. Pediatric dentist. What is a pediatric dentist? That might be a good question. A pediatric dentist is someone who goes to school for 2 or 3 years beyond dental school, and we see only kids. I see children from birth, because sometimes babies are born with teeth, all the way up through usually high school. They think that this office is too kid-like and childish, and then they don't want to come anymore. But the American Academy of Pediatrics and the American Academy of Pediatric Dentistry recommends that the first dental visit for a child is 6 months after the eruption of their first tooth, which the first baby tooth usually comes in around age 6 months. So we recommend no later than age 1 for first dental visits. And I have parents all the time ask me, well, they're not going to sit in the chair. They aren't going to be good. They're going to cry. And that's okay. It's just like when they go get their ears checked. And they don't like stranger danger of someone new being in their personal bubble, especially now since we all have to wear our masks and kids are all freaking out about people being in their space. But that first dental appointment's really about talking to parents about toothbrushing and trauma and pacifiers, thumb suckers, bottles, sippy cups, all the different things that can impact little ones that we as parents may or may not know. And it's more about parent education at that point. And then if a child does have something that a parent is concerned about, they're already a part of a dental home. So for instance, I had a little one today that was a trauma that had fallen and loosened up his 4 upper front teeth and had a big fat bloody lip, and teeth are all moved out of position. And it's nice for them to already know me and the parents to already have a relationship with our office, and the kids already know about our treasure box. And it's nice to have someone to call when you're freaked out because your kid is bleeding all over the place, to have a familiar face. So plus, if you see them earlier, then they're more used to coming in, or they're more used to coming in. And it's prevention is so much cheaper and easier than fixing teeth after the fact. So if we can do whatever we can do ahead of time to prevent cavities from forming in the first place, that's even better.
Do you have any like tips or tricks or suggestions for a child who like tantrums during toothbrushing? Like we bought a spin brush in hopes like that would be, because he literally won't allow us other than like laying him on the floor and sitting on him and pinning him down and brushing his teeth while he's screaming. So we bought a spin brush for him to like chew on. But I always just worry like that's not enough to get his teeth cleaned enough.
So that's a really great question. And you're not the only parent to have that as a concern. I even had one of my sons that was terrible for toothbrushing. And I tell parents it's very similar to if you're changing their diapers and changing a poopy butt. You can't let them go to bed with a poopy diaper, and they can't go to bed with a dirty butt. And you can't let them go to bed with dirty teeth. So toothbrushing is one of those things where if you start when they're very young, they get used to you being inside their face and helping them know that that's just part of the bedtime routine. And the earlier you start that, the better. May not always be possible if you're a foster parent and adopting and getting kids later because you didn't have them maybe when they were younger, or maybe you have a very defiant child like I had one that was super defiant. And it's just personality based. And kids can go through stages too, where they may be super cooperative for 6 months and then terrible for the next 6 months and then cooperative again for the next 6 months. It kind of is normal development for kids to be testing your limits and pushing your buttons all the time. But I really like electric toothbrushes. So if your child likes an electric toothbrush, keep using it. I think anything that you can do to get in there is wonderful. And you might have to change it up. Maybe this week you use an electric toothbrush that has their favorite character on it. And the next time you use a toothbrush that has lights that flash up, or you can connect it with an app on your phone, or you use a sparkly toothpaste this time, and change it up. I think anything that you can do to hold their attention for a week or 2 or 3 or a month would be great, and then try something new. But I'm not averse to parents being a mean mom, mean dad, and just doing it. I literally straddled my son for about 9 months, every single night. And it was a struggle. And then he realized that I was going to do it whether or not he made a big fuss. And so finally he just gave up and he let me brush his teeth. And he never had a cavity, but that's because I'm a mean mom. And I told him, I'm not your friend, I'm your mama. I'm here to make sure you stay healthy. So the other thing, though, is it's age dependent. It's okay in my mind to do that for a toddler. It's not okay to do that and sit on an 8-year-old. Most 8-year-olds are bigger than me, so it's hard for me to justify sitting on a big kid. But I also like the idea of having 2 toothbrushes. If you have a little one that likes to chew on it and the bristles are all bent over and you try to help brush with that toothbrush, it really is not going to be very effective because the bristles are all bent over. I like it if they have one that they can chew and wreck and they can develop their motor skills and learn how to brush, because if you're brushing their teeth for them all the time, they don't learn how. But if you're doing it all the time for them, they're clean, but they aren't developing motor skills, and vice versa. If they're doing it all the time, they're not very clean. So it's got to be a little bit of both. I usually say until kids can tie their shoes or write their name in cursive. That's how long we should brush. Sorry, that was a really long answer to your question.
What about like toothpaste? Like at what age do you recommend and what kind do you recommend, like for infants versus toddlers versus like a little bit older, like 4 or 5?
Sure. My big thing is whether or not kids can spit out their toothpaste. If they're still eating it, I think it's a really good idea to use a toddler safe to swallow toothpaste. Most kids don't like adult toothpaste because it's too spicy, it's too hot, and with minty flavors, but it's really not the toothpaste anyway that gets their teeth clean. It's more of the actual movement of the toothbrush around. So if kids are fighting because they don't like a toothpaste flavor and they don't want a toothpaste because it feels gross, then don't use any. Just use a wet toothbrush. And that should get their teeth clean enough. The reason we like toothpaste is because we adults don't want to have stinky morning breath. And so we want that minty freshness, or we want toothpaste that has a whitener in it or baking soda, tartar control, something. So the toothpaste is more of a vehicle to get those things onto your teeth. For kids, fluoride is very important. So, for us too, for adults. But for kids, we always talk about doing just a smear of toothpaste on the toothbrush. So it's just a teeny tiny bit, not like you see on the commercial where it has a big, huge glob on top. And then as soon as they get to be a little older, then you can use like a pea-size amount, but they have to be good spitters. But to me, it's whatever flavor they like, whatever works. I'm not super picky about toothpaste as long as they don't eat it.
At what age do we teach them how to floss?
Oh, that's good too. Personally, I hate flossing. I think it's terrible for me wasting time flossing. It just takes forever. But I do it. I know that it's good for me to floss. It's challenging to get kids to floss. I think using our big fat adult fingers to try to get inside a teeny tiny little mouth is really hard without them biting us or making them choke because we're getting our fingers in there too far. So I really like those little floss aids that are on the little plastic handles, and they come in dinosaur shapes, and they are princesses, or they have a whole bunch of different flavors, some with fluoride on the floss, some don't. But I think as soon as two teeth touch or they're getting close enough, that if food's getting stuck in there, definitely get it in. Get some floss in there at least a couple times a week would be really good. And I'd like the flossers for ease of use, but I think that they're very, very wasteful. That's a lot of plastic and we're just throwing them away and using them one time. That seems gross and terrible to our earth. So I usually tell parents, you don't use your toothbrush once and throw it away. Just rinse it off and then let it dry just like you do your toothbrush, and then use the same one over and over until that piece of floss breaks off. Then get a new one. Any other ones, questions?
What is your suggestion with pacifiers or thumb suckers? Like with permanent, does it cause permanent damage to teeth?
So it can, and it can't. It just depends on the duration and the intensity of how a kid sucks. Some kids are very passive pacifier and thumb suckers where it just kind of sits there and they're not really sucking on it. And some kids are really going to town, and you can see their cheek muscles going in and out and in and out. And if they're really going to town on it, those are the kids that we tend to see a lot more movement because they're using muscles and their face gets squished. But it's also how long they're sucking. My personal opinion is that we are mammals, and mammals are supposed to suck. That's what we do. That's why we nurse. And kids like to use a pacifier and suck their thumb. But if you do it too long, it becomes a peer need rather than a physiological need. And my training was 18 months that kids should be done with suckies, whether that's thumbs, pacifiers, bottles, even sippy cups. And I know that frustrates parents sometimes because kids make a mess and we don't want them to spill. But I think if we're encouraging them to keep using sippy cups, then they buck out their upper front teeth. So your question of can it damage teeth? It more damages the shape of the mouth and where the position of the teeth are, because some kids can really start to buck out those upper front teeth, and they make kind of that horseshoe shape of your teeth. Instead of being wide, it makes it very narrow because of all the cheek muscles pushing in. So 18 months is really good. After age 2, I tend to see more of the bone being more firmed up, and the roots on those upper front teeth are long and formed, so they don't move back as much. But before age 2, and if a kid quits, then even if they have a big open or overbite in the front, it closes down a lot more than after age 2. That's a good question.
I don't know if you can answer this question or not, but I have a foster daughter who's 2, and she had a really prominent tongue thrust when she came to us. And now that she's settling into her home and relaxed a little bit, she doesn't keep it thrusted out anymore, but it almost seems like her tongue is too big for her mouth. So chewing food, if food breaks apart, I'm trying to think of a food.
An apple chunk?
No, well, that too, but meats, you know how when you chew meat, it kind of breaks apart in your mouth. Mm-hmm. And so she literally is unable to move it to the back of her mouth to be able to swallow it. So are there any things we can do at home to help her, or is it just something that she has to figure out on her own?
It's hard to know without looking at her tongue and the shape of her mouth. I wonder if her teeth are lined up correctly. It sounds almost like her lower jaw might be a little far forward. I see that sometimes with kids and they kind of posture forward. So then their tongue sticks out more too. So you might look at her teeth and see if all of the top ones are on the outside with the bottom ones tucked underneath. Because if they are sticking out where her lower jaw is way forward, then it sometimes looks like their tongue sticks out more. And then when she talks, can she close her teeth so that the front ones hang over the bottom ones with her tongue inside, or is her tongue sticking out no matter what? I'd have to see it, I think.
Okay.
And then one other question, when she sticks her tongue out, that little piece of skin underneath her tongue, is it super short and thick? She might be tongue-tied. That might be part of the issue too.
She is. The dentist that they had us take her to was Alpha Omega, and they said that she was tongue-tied, but she's
they gonna
able
clip
to
it?
make, well, she said she's too old to clip it now. Because they would have to numb it, and she probably wouldn't sit there to do it. And so like if she went in for like to have tubes or something put in, to have the doctor do it then, but at least the dentist at Alpha Omega wouldn't do it.
Yeah. Yeah, that's interesting. So my training was that if kids are tongue-tied, but they can stick their tongue out past where it changes from skin color to lip color. So if your tongue goes out beyond that, it doesn't need to be clipped. But if she can't stick her tongue out beyond where it changes from pink to skin, then that's when it should be clipped. So you could check that.
Yeah, I'll have to have her try that.
Tricia, anything else?
So we often hear that they're just baby teeth, so why do they matter? Can you help me with that?
Sure. So the baby teeth are just baby teeth and they are going to fall out, but the first few baby teeth fall out, the bottom front ones, at around 5.5 to 6.5. And then the furthest back baby molars, the 2-year molars, they fall out at 11.5 or 12. So kids have those for a long time. And baby teeth have many different functions. Number one, it's because they smile and they look beautiful. And we don't want kids to have black teeth in the front that they're embarrassed to smile about. I know we're all wearing our masks these days and we're not seeing each other's smiles as much as we used to. But it also, if you don't have teeth, then it's hard to chew your food. And a lot of kids choke on their food. A lot of kids have indigestion kind of issues because they aren't chewing up their food very well. A lot of kids, if you take out teeth and before they're due to fall out, then they shift around and they make it so that there's not space for the big teeth to fit in when it is actually time for the tooth to fit. Another big thing is speech. So a lot of kids that don't have their front teeth try to make an F sound with no front teeth, or S. It's really hard to make certain sounds if you don't have your front teeth. Make a B or a letter P sound. You really have to wrap your lips around. And so a lot of kids with speech issues, it's because of, as we talked about earlier, their tongues being in a different position or their teeth. So try a TH. You have to put your tongue up behind your upper front teeth. They call those sibilant sounds. So speech is a big one. But for me, aesthetics. I think it's so disheartening when I see little ones come to my office and they tell me that they don't want to smile because their teeth are ugly, and it breaks my heart that they're embarrassed to smile. And yeah.
And another question, if a child has a toothache and you're waiting to go to the dentist, how would you, what would you recommend using to help the pain or help them be comfortable until you get into the dentist?
Well, hopefully you have a dental home so you can get in like right away. But if you don't have a dental home, then I usually recommend an over-the-counter medication like a Tylenol or a Motrin. And you could try something like an Ambisol if it's more on the gum tissue, but that's not really going to help the tooth itself. So avoiding things that are super hot, super cold, or acidic, that would help a little bit too. But unless you could figure out what's actually causing the toothache, is there a piece of food stuck in there? Maybe we could floss it out. It's hard to know exactly what, but try over-the-counter pain medicine and maybe a little bit of a hot alternated with a cold pack. Sometimes that helps too.
So I have a question.
Sure.
So what is the difference between like a pediatric dentist and a regular family dentist?
Sure.
Like, are they able to do the same things that you provide, just focusing on kids, or how does that work?
So I am a general dentist first. So in order to become a dentist, you complete a whole bunch of classes to get into dental school. Usually it's a 4-year program after you get your 4-year degree. So you do 4 years of undergrad, 4 years of dental school, and then if you pass all of your boards, then you can take your exams and set up a shop, and you can open a general dentist office. So most general dentists say that they're family practice, which means they can see kids, teenagers, moms and dads, grandmas and grandpas. They can see everybody, and they usually know a little bit across a broad spectrum of knowledge. So they know a little bit about a lot of things about dentistry. You can go to school after the 4 years of dental school, and usually they are 2 or 3-year programs where you can specialize to become, there's right now 9 specialties. You could be an orthodontist, an endodontist, a periodontist, an oral surgeon. There's a whole bunch of them, but one of them is pediatric dentistry, and that is either the 2 or 3 years more from school. And so that takes that broad, that you know a lot about, you know a little bit about a lot, to just this little bit, but now I know like deep. I know a lot more, but ask me to make a denture and I don't know how to do anything for grandmas and grandpas over here. I haven't done a root canal ever on an adult tooth. I've never made a denture ever. I've never done anything in gold. So I don't know how to do gold stuff. But where a general dentist might take 45 minutes to do a stainless steel crown for a kid, because they don't do them all the time, because I do them every day, all day, I can get it done in less than 5 minutes. But you ask me to do an adult crown and it would probably take me like 4 hours, because I don't know how to do an adult crown. So yes, a general dentist can do many, many things that a pediatric dentist is, especially if they do a lot. Let's say on that big long spectrum, maybe they do like this much and they're just doing kids through teenagers and early adults, and they aren't really focusing on implants and dentures and that kind of thing. So it depends on where their focus is. Some general dentists love working with children and they do a really good job. And then some general dentists tell me, I don't ever want to see another kid in my chair ever again, because I like working with older adults. It just totally depends on people's personalities and what they're comfortable with and what they learned in school. If they never learned how to do a sealant in school, hard to imagine, but maybe they never did one. They wouldn't know how to do sealants for kids' teeth. So I'm a general dentist first. I just happen to do more school after the fact. Yeah.
How often should we bring, like, once they have their first couple of teeth up until like 2 and 3, how often should we bring them to the dentist?
It depends on the kid. So just like you and I, if we have, some people's hair grow really fast and some people go to get their hair cut once a year. And same thing with kids. Sometimes we see patients once a year, and sometimes our kids who are super high risk, that already have things that we're worried about and concerned about, we see them once a month. So if today I saw a little one that is starting to get cavities on his upper front teeth, but he's behaviorally not ready for me to fix his teeth. Mom doesn't want him to be held down, and I don't want to hold him down to fix teeth. So we're going to check his brushing once a month, and I'm going to put fluoride vitamins on, and we're going to talk about brushing. How's it going? Getting rid of the bottle and that kind of stuff. So it's a lot of encouragement once a month. But usually the little ones, age 1, 2, 3, they're not super cooperative yet. So it depends on the personality of the kid, depends on what the kid needs, and the parents' availability and willingness to come in too. Maybe they can't take that much time off work, take the kid out of school, especially winter. It's hard to travel around here in the UP with the weather so terrible.
And for parents that a dentist recommends doing x-rays, can you explain, like, are those safe for kids?
So x-rays have come a long way since we were kids, and nowadays most dental offices are switching over to digital radiographs. And digital x-rays use a lot less radiation than the old school x-rays. And the other nice thing is you get an image right away. So you can show it to the parent and the kid right away, and it's super exciting, and you can make a big deal of, look at that, your teeth are so cool, and let's do the other side. And for compliance reasons, I think it's a lot easier to do digital for kids. The frequency of doing them depends, again, as we were talking just a minute ago, on what each kid needs. So if you're watching something, if it's getting close to the nerve, if it's hurting them, you may want to take it more frequently than if you had a kid who has never had a cavity. They're doing an amazing job brushing their teeth. They don't eat a bunch of junk. I might say, let's take x-rays every year and a half, 2 years. We might not, even 3 years. It just depends on what that kid needs. If they're at that age, 11 and a half to 12, where all of their baby teeth are falling out and all the new ones are growing in and they're doing great, I wouldn't take x-rays of those because they're brand new teeth and the baby ones are falling out. Unless they're hurting them, I wouldn't probably take an x-ray. So it just kind of depends, but they are super, super safe these days.
I have a question. So I had a parent contact me, I don't know, like a week or so ago, panicking because her older son lost a tooth and she was afraid that it was an adult tooth and not a baby tooth because she couldn't remember if he lost it or not. So how does a parent know, like, what the difference is between a baby tooth and an adult tooth? Like if their child is at the age of losing teeth?
That's a tough one. For me, it's super easy because that's what I do every day is look at teeth. And I know the size and the location of where they're supposed to be based on the age, but I would say take a picture of it with your cell phone and send it to your general dentist or your family dentist, wherever you go, and say, hey, is this tooth supposed to come out? Is this one missing? If you have it, you can hang on to it and see, and you could take a picture of that too. You could look up on the internet to say, okay, my kid is 5.5 and just lost this one. Is that one supposed to fall out? Yes, that's awesome. But if they are 14 and losing a tooth, probably not. They aren't supposed to be losing any teeth anymore at age 14. So maybe Google it and find out. We can find out so much stuff online.
Do you notice any like common brushing blind spots with kids, like spots that they're missing that like in particular that maybe parents should be looking out for to make sure they get those spots?
My number one spot kids always miss, underneath their tongue, turning that toothbrush on its side and shoving it way back underneath your tongue. Most kids do really great brushing the cheek sides and biting surfaces, the tops of their teeth, but turning it on its side and getting way to the back, especially around age 6, when they get those 6-year molars, they're not used to getting the toothbrush that far back down by their tongue without choking themselves. That's my number one spot kids miss. The number 2 spot kids miss is upper cheek side. So they open their mouth really wide to brush their teeth and it makes your cheeks too tight. And then you can't get your toothbrush in there. So they miss, you got to kind of close your teeth a little bit to create space to get your toothbrush back there. So upper molar cheek side, lower molar tongue side. 2 most common places. Front ones are usually clean. Biting surfaces, usually kids do a good job.
Okay, if we don't, do you have any more questions? If not, we can maybe close it out by maybe giving some tips for parents to prevent tooth decay.
Ooh, okay, so the number one reason why I see kids, especially right now in the COVID times, for kids getting cavities is because they're playing video games or they're watching TV or they're inside the house and they snack all day long. Kids are grazers, and it's easier for us to keep kids occupied to just give them something to eat. So they eat a whole bunch of little meals all during the day, and they carry around a cup with diluted juice. So kids that I see that are sippers and snackers get a ton of cavities. Those kids that I see that eat 3 squares rarely have cavities. So I tell parents I would rather that they drink the entire container of juice in one sitting and chug it all at one time rather than diluting it and sipping on it. Because every time you take something to drink, it takes 20 minutes for it to go away in your mouth. If you're eating something that's a little bit carbohydrate-ish, it can be like cereals and crackers, that's in there for 20 minutes. So if you're snacking and grazing on goldfish crackers all day, your teeth never get a chance to rest. And then people think that sticky chewies like raisins and fruit snacks and granola bars are good for your teeth, but they're really not. So just not snacking all day long. That would be my number one way to not get cavities right now, is limit the times that your kids eat and drink during the day.
So what questions do people usually have about braces when your children are young?
So the American Academy of Orthodontists and the American Academy of Pediatric Dentistry recommends that if we see kids who look like they are having teeth come in all crazy, to send them to the orthodontist around age 7. And not that they put braces in on age 7, but they may tell me to, hey, Erika, take out this tooth here and this tooth here and let's make some room. Maybe they want to put a retainer in or a palatal expander and make some room as they're growing. But I often tell parents of little ones, when I look at their teeth at age 1, 2, 3, I can already tell if they're going to be crowded and need braces a lot of times. So things like thumb sucking, pacifiers, if they always sleep on one side of their face and their face maybe is growing in a certain direction, I can tell kind of that things aren't lining up the way that we'd want them to line up. But usually for kids, we want to see a picket fence between baby teeth. So those kiddos that have gorgeous, beautiful lined up teeth that have no spacing, usually those are the kids that are going to be really crowded, because those adult teeth are always twice as big as the baby teeth. And yes, their face grows, but is it going to grow enough to make enough room? Usually not. And if parents had big teeth and needed braces, or the parents had crooked teeth, I usually tell our families it's like having blue eyes or brown eyes, or big ears or little ears, or big nose, little nose. Big teeth run in the family just the same. So if you as a parent had braces, it makes sense that your kids are probably going to need them too. But if they have crowded teeth with their baby teeth, then for sure, I'm like 100% they're going to need braces. Or we may have to remove some permanent teeth to make room. But that's why it's good to go see the orthodontist around age 6 or 7, because then you can make room as they're growing and get good guidance. And sometimes if you do it and you time it right, you might not even need braces when they're older if you made room when they're growing.
Any more questions?
No. Well, it was a good conversation. Thank you.
Yeah, thank you for joining us.